Good evening and welcome, families, to the COVID-19 What Families Need to Know Town Hall discussion. My name is Justin Uppinghouse and I'm the principal at Whitsitt Elementary School. On behalf of our MSAP schools, we would like to welcome you all and thank you for joining us tonight. Next, we're going to have Principal Ashley Croft from Inglewood Elementary giving us a brief housekeeping message and informing us of our meeting norms. Principal Croft?
Hi everyone, I'm Ashley Croft and I'm very proud to be the principal at Inglewood Elementary here in East Nashville. Tonight we're really excited to have y'all here to talk about what families need to know about COVID-19. A couple of things for you to know going into this conversation. We're not going to be talking about vaccines tonight. We're going to be talking about keeping your family safe and other questions that you may have related to the COVID-19 pandemic, but not specifically about vaccines. Any questions that you have, you should be able to type those into a chat box. Up at the top right of your screen, it looks like a little speech bubble with a question mark in it. If you click there, you should be able to type your questions in and those will go to our moderators so we can answer those later in this presentation. So now I'm going to hand it over to Principal Kelly Akers from Rosebank to introduce our moderator.
Good evening, everyone. I'm Kelly Akers. I am the principal of Rosebank STEAM Magnet School, and it gives me great pleasure tonight to introduce our moderator, Samuel Jackson. Samuel Jackson is the Senior Program and Community Engagement Officer at the Healing Trust, a health legacy foundation located in Nashville, serving 40 counties across Middle Tennessee. He manages the physical health grants and implements THT's advocacy work specific to that portfolio. He also engages with underrepresented communities to understand how the trust work can further align with community needs. Sam has 18 years of combined experience in education and the nonprofit industry, serving in a variety of roles. Sam has built programs, partnerships, and raised funds throughout the Nashville area. He most recently worked with youth and families in Nashville, serving as the executive director of the Horizons program at the University School of Nashville. Sam earned his Bachelor of Science in Social Work and Master's in Health, Physical Education, and Recreation from Tennessee State University. He is also a certified fundraising executive. It gives me great pleasure to introduce our moderator, Samuel Jackson.
Thank you, Mrs. Akers, for the kind introduction. Once again, my name is Sam Jackson, and I will be your moderator for the evening. Tonight, we'll be discussing COVID-19 and what families need to know. But first, I must thank all of our families who will be spending the next hour with us. We hope tonight's program finds all our families safe, healthy, and warm. Our goal this evening is for you to walk away with a better understanding of COVID-19 and how it impacts you and your family. To give you an overview of how the night will go, we have 4 amazing panelists who will be covering 4 topics around COVID-19. Our panelists will spend 5 to 7 minutes on each topic. Our first 2 panelists will speak, and then we'll have a short Q&A to follow, and the same for our final 2. If you have any questions at any point during this presentation, please feel free to put those questions in the chat. Remember, tonight, we're only taking questions about COVID-19 and not vaccinations. So let us get started. I would like to introduce you to the first 2 of our 4 panelists. Our first panelist is Dr. Gerald Onuoha. Dr. Gerald is a native of Huntsville, Alabama, a fellow Tennessee State graduate. Go Tigers! He received his doctorate from Harry Medical College and a degree from Dartmouth in clinical practice. He is currently a hospitalist at HCA. Dr. Gerald will be giving us an overview of COVID-19.
Thank you so much, Mr. Jackson. Hello, everyone. Thank you for inviting me. So I'm here to talk about coronavirus and just give you a brief overview of COVID-19. So coronavirus comes from the Latin word crown, and it's called that because the virus looks like has a crown on its surface when looked under the microscope. There are different forms of coronavirus, and some cause illness and disease in humans similar to the common cold or a mild respiratory virus. Some are so common in humans that it's likely that everyone on this call, on this webinar, has probably had some form of coronavirus in the past. Now, just like there are coronaviruses for humans, other animals also have a form of coronavirus. And sometimes, although very rare, the animal forms of coronavirus are able to transfer from animals to humans. This is called a zoonotic disease. And COVID-19, also known as SARS-CoV-2, is a zoonotic disease. COVID-19 was first discovered in Wuhan, China, back in December of 2019, when a group of market sellers got an unusual respiratory virus. In February of 2020, the World Health Organization was notified that a novel respiratory virus was going on and it was going around the world. One of the first cases of coronavirus was found around January in the United States, in Seattle, Washington. COVID-19 is a problem because it's a droplet and airborne disease that gets into the body mainly through the airways and through the mucous membranes. So that means through the mouth, through the nose, and through the eyes. And once inside of the body, it attacks the cells in our bodies that contain receptors or doors to get into the body, allowing the COVID-19 virus to invade the cells. Once it invades the cells, it attacks the organs like the lungs, the heart, the kidneys, the intestines, and the blood vessels. Now, COVID-19 can hurt the body in two different ways. It gets into the cell like we talked about, where it hijacks the machinery of the cells and causes the cells to die, but it also triggers the immune system, making the immune system go haywire and giving it an exacerbated response that turns the body over and causes cell death. And once these things happen, the body or people normally have a few symptoms. One, fever, the next headache or cough, shortness of breath, fatigue, body aches, and diarrhea. And so as it stands today, there are about 110 million cases of COVID worldwide, or there have been, and about 2.4 million deaths worldwide. In the United States, there have been 28 million cases and about 490,000 deaths. In Tennessee, here in our state, there have been 747,000 cases and 11,000 deaths. And in Davidson County alone, there have been 88,000 cases and about 816 deaths. Are there any questions so far?
Dr. Gerald, what we'll do is we'll have questions after Dr. Ritu.
Okay, that's good.
And what we'll do, thank you for the overview. We'll move on to our second panelist, Dr. Ritu. Introduce her. Dr. Ritu is an associate professor at Pediatric Infectious Diseases at Vanderbilt University. She is the director of Antimicrobial Stewardship Program at the Children's Hospital. She received her MD and PhD from Washington University in St. Louis and finished her residency and fellowship at the University of California in St. Louis. We are so grateful for Dr. Ritu's service. She has been on the front lines of the pandemic, caring for children who have been hospitalized with COVID-19. And Dr. Ritu will be discussing where we are now. Welcome, Dr. Ritu.
Good evening, everyone. Thanks so much for this opportunity to speak with you all. I'm going to echo a little bit of what Dr. Gerald said and then expand a little bit more on the immune system going haywire, as he mentioned. So I just want to start by saying, you know, the numbers that Dr. Gerald mentioned are really high. You know, globally, the number of infections and deaths due to COVID-19 have been just, you know, scary to think about. But in pediatrics, in children, the infection has been much less severe. So that's really important to keep in mind for parents out there, and I'm a parent as well. So in the US, there have been slightly over 3 million children who've been infected with COVID-19, and the vast majority of them do just fine. They remain outpatients. They never have to go to the hospital. They may have no symptoms at all, or they may have symptoms like having a mild cold or a diarrheal illness. And then a very small proportion, 1 in every 2,000 or so infected children, will end up having this multisystem inflammatory syndrome, or MISC, which you've heard on the news. But the vast majority of kids do just fine with this infection, and about half have complete symptom resolution after 2 days. And that's what we've seen in our registry of over 3,000 children at Vanderbilt. So let me tell you a little bit about multisystem inflammatory syndrome, or MISC. We don't know why certain children develop this, but as Dr. Gerald said, it's your immune system going haywire. It usually appears in kids, of any age, roughly about a month after they've had an initial COVID-19 infection. And it really is involving inflammation in multiple systems in the body, including the heart, the gastrointestinal system, the lungs, the kidneys. And the symptoms are very nonspecific, but usually fever, abdominal pain, vomiting, diarrhea. You can also have, children can also develop neck pain, they'd be really tired, they could have a rash, they could have bloodshot eyes. But in general, it's a child who's pretty ill. It's not just a child who maybe ate something bad for dinner the night before and is having a short-lived diarrheal illness, okay? If your child develops something like that, you would have them evaluated either in an emergency department or by their doctor, who would be concerned and enough to get some blood work, and that would help us figure out if we're dealing with MISC or not. Usually when we've seen MISC, children have been hospitalized. We've given them medicines like steroids or intravenous immunoglobulin, which calm down the inflammatory system. And usually these children do just fine. We've had 37 children with MISC admitted to Vanderbilt Children's. On average, they've stayed in the hospital for a week. By 3 or 4 weeks after their diagnosis, they've all been back to normal. It is important, though, to remember we are most worried about inflammation in the heart in these children, and so they need to be cleared by a cardiac specialist, a cardiologist, before they can resume gradual return to physical activity and sports.
Perfect. Thank you, Dr. Ritu. So we do have a few questions from the audience. Dr. Ritu, Dr. Gerald, please take them on as you can. Our first question is there any evidence that zinc or vitamin D are effective in helping prevent infection or severe symptoms? So Dr. Ritu, Dr. Gerald, either.
Dr. Ritu, I don't know if you want to take this or me. So there hasn't been any evidence that I've seen. Vitamins like zinc and vitamin D, they allow your body to do what's already supposed to happen with your immune system. So in doing that, it doesn't boost your immune system, but it just helps it to work correctly. The best way to fight COVID-19 is to, 1, wear your mask, 2, make sure that you're socially distancing from other people, at least 6 feet, and staying out of very large crowds. And then one of the most important things is washing your hands often and cleaning surfaces often. And that looks like washing your hands with soap and water for at least soap and warm water for at least 20 seconds, or hand sanitizer with at least 60% a 60% alcohol level.
Perfect. And that brings us to the next question, which goes with that. Should kids be required to double mask?
Dr. Ritu, I don't know if you want me to take that or you.
Well, I'm happy to try, and then you please add to my answer.
Yes,
I think the data on double masking, I know the CDC has recommended that, in particular because of concerns that these new variants of the virus are more contagious potentially than the original strain of the virus. I think the data on whether or not we really need to double mask is not clear at this point. We know those of us who work in medical centers, healthcare settings, a single mask is very effective at reducing transmission. We also know in schools that have been open throughout many parts of the world, a single mask, physical distancing, hand washing, all those strategies that Dr. Gerald just mentioned have really demonstrated there's not much in-school transmission. So to me, it's a success if we can get kids to, if we can enforce single masking in kids, and including, you know, during times when they're in gym class, for example. And I would focus more on a single mask and not so much on the double masking.
Dr. Ritu is absolutely right. Even though there have been some recommendations of double masking because of the variants, we have not seen sufficient data yet that shows that wearing 2 masks makes a difference. So having the practice of wearing a mask is the first step. And I think that once we do that and the data comes out, it will probably show that doing that with the social distancing and the washing of the hands, like Dr. Ritu said, will prevent the transmission of the disease.
Dr. Ritu, you mentioned variants and that there's different variants of COVID-19. Can you explain more about that?
Well, the virus has mutated over time. And so there have been changes in the genetic code of the spike protein that Dr. Gerald mentioned is on the surface of the virus. And thus far, we know of 3 variants, the one in the United Kingdom, the UK variant, the South African variant, there was a Brazilian variant, and now, I'm sorry, there's also a 4th one that I've read about in the news from California, a California variant. Thus far, the data aren't really clear if they're truly more contagious than the original strains, or if they're truly more virulent or more deadly than the original strains. So, you know, and the other thing is that undoubtedly this is normal. This is part of kind of the natural history of the evolution of a virus. It will change over time. And so there are probably many other variants throughout the world. We just haven't done a very good job of systematically looking for them yet. And so the CDC now is putting more effort into doing that. So I'm not surprised at all that we have new variants. And I'm looking forward to reading more about the research to see if we really truly need to be concerned about them or not. I think there is good news though, which is the vaccine. And the only thing I'm going to mention about the vaccines tonight is that we know that the vaccines that have been approved in the United States thus far have shown good efficacy against the variants that have been identified thus far.
Perfect. Our next question. So, Dr. Gerald, is there any information about the long-term effects of COVID-19 in children physically or psychologically?
Well, I think that's a better question for Dr. Ritu to answer, only because I see very few children. I am a COVID specialist. I see a lot of COVID cases, but I don't see a lot of children when it comes to COVID. So, Dr. Ritu?
But you know, by and large, most kids are recovering without any long-term side effects. There are rare instances, and these are the ones you read about in the news, about children having brain fog or kind of long haul COVID symptoms. But you know, this happens often with any viral infection sometimes. Mono is a perfect example of an infection that can have long-lasting, lingering effects in children. And so I haven't seen too many of them. I think that it's rare when it does happen. And I think the other really good news is we haven't seen a lot of significant cardiac problems or heart problems in these kids who've had the hyperinflammatory syndrome, or MIS-C. So that's very reassuring.
Speak with you, Dr. Ritu. Have you seen any difference in severity of the illness in young patients versus adolescents? Has there been any difference?
Yeah, that's a very good question. In our hospital, the children who've been hospitalized with trouble breathing and more COVID symptoms that are more similar to adult COVID have been adolescents. So it does appear to be a much more mild infection in younger infants. And in fact, we've had babies who've been born with COVID that they've gotten from a COVID infected mom who've done just fine. They haven't had any symptoms at all. So it seems like adolescents may have disease a little bit more similar to adults, but even so, most of them have recovered without any problems.
So we know there's a lot of information out there, good information, misinformation. I know you all stay in the data, read everything that's out there for the most part. For the people out there, who are those trusted sources that you look to in regards to what's happening next, rules that we should be following, and just pretty much good, people to follow up on and read up on.
So there are a few places where I get my information when it comes to COVID-19 or SARS-CoV-2. One, the CDC gives very good information about COVID-19 and it's very comprehensive. Most people can understand it. Another place I'd look is the local health department. They're going to have a lot of information about COVID, and it will also be compartmentalized to whether it's adults or children or people with chronic illnesses, so that you can understand the recommendations that they have for those particular people. So I think that starting with those two sources as go-tos for information on COVID-19 is a good place to start, and then you can read other places as you go.
Thank you. Well, we know it's cold season. There's a lot going on. People are still getting sick with the regular cold, regular flu. If you wanted to talk to parents, how can they identify as far as signs and symptoms, or know when to bring their child in order to see you for COVID-related symptoms, or to know to get tested? What are those symptoms and signs?
I'm happy to answer that one, Dr. Gerald. So, is it all right if I answer?
Oh, yes, ma'am. Absolutely.
Okay, terrific. So remarkably, we have had very little circulation of other respiratory viruses this year. We have had no flu circulating in the community. We've had no respiratory syncytial virus. Usually we have tons of little children with bronchiolitis from this virus called RSV. We've had none, zero. So all of this masking and distancing has really paid off in terms of reducing community transmission of other respiratory viruses. So right now, with the epidemiology of the viruses that are circulating right now, if your child has cold-like symptoms or fever, it's probably going to be COVID rather than any of the other common cold viruses. And so that would be a reason to go ahead and have them see a doctor and get a COVID test. Because even if your child is going to do fine and handle that infection just fine, you need to know if they need to be isolated if they have COVID. You need to make sure that close contacts of that child are appropriately quarantined. You need to know if there are high risk people like grandparents, for example, that child should not be exposing.
And just to echo off of what Dr. Ritu said, most children who get COVID-19 do have very mild symptoms. One thing that I think about is the transmission to those family members, those loved ones that have some type of chronic issue. And so if you have a child that does get sick, it is, like Dr. Ritu said, a good idea to go ahead and get tested, because we haven't seen a lot of the other viruses, the other respiratory viruses in the hospital as of date. So making sure that you quarantine that child, get them tested, and make sure that they're not spending too much time around their loved ones, especially the older population with chronic illnesses, is the best thing to do.
Perfect. We do have a classroom related question, so I do want to bring in Dr. Gibbs, who's the principal at Warner Elementary, if he can come on board for this question. And that question is, Dr. Gibbs, how are the teachers dealing with COVID in the classroom?
All right, thank you for having me. And Gerald, always a pleasure to see you in this setting, man. Hadn't seen you rock like this since undergrad. So teachers are handling COVID in the classroom, being mindful of their safety as well as our boys and girls' safety by making sure that all of the desks in the classroom are facing one direction, and when possible, the desks are spread out at least 6 feet apart. If the desks cannot be spread out 6 feet apart, students wear a mask as well as a face shield inside the classroom. We have removed all of the carpets, especially in the elementary setting. We're used to bringing students to the carpet and being in that close-knit setting when we're doing shared reads or read alouds. We've removed the carpets for this school year, so students are not coming to the carpet, so they're not in those close quarters. Anytime students are coming in and out of classrooms, they are sanitizing their hands often, as well as using soap and water frequently throughout the day. Especially anytime they're changing classrooms, meaning coming from the classroom to the cafeteria or to, one of the related arts classes and things of that nature. So if a teacher notices a child has a fever or just isn't feeling well, they're immediately sent to the school nurse to be evaluated. So there are just different levels of protocols that we're using, not only in the schools, but also making sure that teachers are aware of those same protocols in classrooms to ensure that all of our students are remaining safe, as well as all of our teachers are remaining safe.
Thank you for answering that, Dr. Gibbs. I truly appreciate that. So we're gonna keep this train moving. Thank you, Dr. Ritu. Thank you, Dr. Gerald. That was great information. So we're gonna move forward at this point. Please remember, if you have any questions, please use the chat function. Put your questions there. We'll be happy to answer them. Up next is our third panelist. Our next panelist is Dr. Theodora Pennick. Dr. Pennick received her BA from Rice University in Houston, Texas, her MD at the University of Texas. She completed her pediatric residency at Washington University, St. Louis. Finishing up her post-residency and fellowship at the University of North Carolina, Chapel Hill, Dr. Pennick currently serves as assistant professor of pediatrics at Meharry Medical College, where she teaches and trains students and residents. Tonight, Dr. Pennick will discuss parents, tools in your toolbox. Welcome, Dr. Pennick.
Thank you. Good evening, all. Thank you very much for this opportunity to talk to you about, in particular, the learning in COVID. I'm a developmental and behavioral pediatrician, and I get the honor and opportunity to deal with kids with all types of learning styles, and in particular, sometimes learning difficulty in the classroom. And so one of the things I really want to talk to parents about tonight is trying to have your child best prepared for either the classroom, or if they're going to have to do it virtually, that virtual classroom. In particular, if they have a developmental disability like attention deficit hyperactivity disorder or autism or any type of learning disorders. It is certainly not news to anyone that learning in a virtual style has been very challenging, and especially to kids who already have some difficulties. So I'd like to give you hopefully some helpful tips. If your child does have an individualized education plan and some special needs in the classroom, I'd like to talk briefly about that too, and how we could better help. The one thing the virus has done is brought about a lot of change, and what we know to work really well in a classroom in learning environments is structure, and routinized or routine structure seems to work better, especially for kids with developmental disabilities. So I would tell parents, definitely try to have a routine every day for their child. If the child is learning virtually, have them get up, get breakfast, and get dressed. I've heard different different tips on whether or not to let your child stay in their, in particular, pajama bottoms and stuff. I think psychologically it's more helpful and effective if you have the child get dressed just like they were going to a school classroom. Also, if you can cut out background noise and things like television in the background, washing machines, all that, just to keep that environment as quiet and as focused for your young one, I think you would find it much more helpful. In some of the school classrooms, you see the dividers. I have talked to parents about just going to the store and getting that 3-sided divider and let the child decorate that divider just like they want, and that be the child's classroom with their computer, to really try to keep things as focused and to eliminate as much distraction. Research has borne out what we probably already knew, is that it's easy sometimes, especially with a screen, to get distracted and not stay focused, and especially if the teacher is talking or the teacher is trying to work with another classmate. So trying to keep your kid focused and learning is what you really want to do. I developed a little acronym called SAME. SAME, and the S stands for schedule. If you can keep that schedule as routine as possible, parents of kids with autism know that routine usually works better. And so even if they could have a visual schedule at home, definitely follow their individualized education plan at school, but even at home, put that schedule up so your child could see. If your child has ADHD, even a visual schedule tends to be helpful to keep the child on track and keep the child focused. Also, getting potential notes from the teachers and going over that class assignment or teaching during the day. If you can at night. I know some parents are working all through the day, so it's very hard to do that, but on the weekends and at other times, to reinforce some of those lessons that the child is learning that they might have not been as focused on, especially in a virtual setting. And I know, if I'm talking to some of the teachers out there, trying to teach even professional graduate students is a challenge, trying to keep them on track and keep them focused, especially with large volumes of material. So trying to keep the children as engaged, and parents, things like if they learn a new word, let them act that word out, will help their memory around that word. If they learn a new concept, trying to help them make up questions that they could ask, and try to be fun. School can get old very quickly for kids, so you can do it in the form of Jeopardy or some of the other games, and just make it a game for them when they're learning a new word or acting out a new word. The A stands for active, and active learning, and not only trying to keep the young person active during the time that they're in the classroom, but you as parents or caregivers engaging that child about what happened in school and what they learned, and trying to also help them be active. Especially this week has been a little tough because kids can't even go outside. Well, they can go outside some and play in the snow, but not in long periods of time. So it's very hard. But I would try to find times in the day that the child can stay active. I know even with the classroom learning, they're doing some PE and physical activity, but that certainly helps the child and helps keep them on target. M is for motivate and monitor. You really need to monitor how your young person is learning and see what they're learning. We know that it has been a struggle this year and that kids can be falling behind. So we as parents definitely have to try to keep them motivated and ask them excited questions. Don't just ask, well, what'd you learn today? Or I know you are on the computer. Make it fun. And the E stands for engage and encourage. Trying to keep the young person engaged and encouraged about school, whether it's in person or virtual, is very important. One of the things that if your child has an individualized education plan and are really seeming to struggle with, in particular, the virtual side, I know recently the children started going back to schools, and especially those with the IEPs. So this might be a moot point now, but if the child's going to stay in the virtual setting, asking for particular services like the recording of the lessons or that the lesson plans be sent home to the parents so they can reinforce that with their kids that have the individualized education plan. Those things are very important, and it's very important to try to maintain as much in the learning environment and making sure our children learn. Let me throw in one other aspect that's very important. And it looks like we're having problems with that because we certainly see the studies that look like children are having more anxiety and depression about school, is sleep. Trying to make sure your child has a good amount of scheduled sleep is very, very, very important, because sitting in front of a computer screen, especially if you've had limited sleep, certainly is and can be problematic. So really trying to do things that will make sure, and these sort of sound like basic things, but they're so important in keeping the child on track and keeping that child learning during this time. One more thing to add. One thing that we see, especially in our children with developmental disabilities, if they're in a virtual setting, that they may need more frequent breaks. And so trying to have an active break versus just them being able to turn away from the computer, but get up and do some type of exercise or dance, or just for a short period of time and come back, can be very important. So I hope those things are helpful in things to remind parents, whether your child has special needs or not, is very important to keep that structure in place so that your children can maximize their learning, whether it's in that virtual setting or back in the classroom.
Perfect. Thank you, Dr. Pennick. Thank you for equipping our parents. Please stand by for the question and answer. Right now, I do want to introduce Nurse Powell. Nurse Powell is a public health nurse working at MNPS, a graduate of Belmont University, and has worked at MNPS school since 2016. Nurse Powell is my hero because I spent a lot of time in the nurse's office. So Nurse Amy will be discuss how to protect your family. Welcome.
Hi. Hello, thank you so much. I'm so excited to be here this evening, and I love being a school nurse. It is the best job I've ever had. I think it's just the best job anyone can have. It's so much fun. One of my favorite parts of being a school nurse is telling parents how they can advocate for their kids and to work with them in keeping their kids safe at school and healthy so they can be at school and learning. So as much as I love seeing kids, I also like to move them out of the office so they can get back to class. That's part of my job. So tonight, before I answer any questions, I wanted to share a little bit about what MNPS is doing and what we as school nurses are doing in the schools to help prevent the spread of COVID in the schools. And I have been personally so impressed with just what I have seen from when we were back in the fall. I'm currently at Dan Mills Elementary School in Inglewood, and we did not have any cases of in-school transmission. We had children coming in who had contracted COVID from after-school play dates or weekend soccer practices, family gatherings, but we did not have cases spreading, student to student in the classroom. So after I saw that, I actually made the decision for my own child, who's a middle schooler in MNPS schools, that she will be going back to in-person school. So MNPS they're following the latest CDC guidelines, and they've actually been doing the same thing that the CDC has recommended this year by going by the metrics and using mitigation strategies. And when people ask me about mitigation strategies, I always refer to something that I have learned from public health experts that I follow, which is the Swiss cheese model. And I had my daughter help me with this. So what we do is we know that masks are super important, but are masks 100% effective? No, they have some, they have some holes, like a slice of Swiss cheese. But when we combine them with another thing like testing, MNPS is going to be doing some randomized rapid testing in the schools. So, hey, that helps a little bit cover some of those holes. And then when we combine that with distancing, super important, but is it 100%? No, because sometimes those droplets spread a little farther than 6 feet. So we combine that, and those help cover the holes. So hopefully by using all these strategies, we can continue to help prevent the spread in the schools. So what can parents do at home to prepare their kids who are going back? I think the most important thing that you can do at home is make sure your kids know how to wear a mask and wear them all day. And I have been so impressed with the students. I mean, the preschoolers, the kindergartners, they have been doing such a good job with their mask. It's not like when you go to Walmart and you see adults with their mask beneath their nose or not wearing one at all. These kids are great about wearing them. One thing that does happen is kids come in and maybe the masks are just too big or they don't fit well. Well, MNPS has disposable kid-sized masks at all schools. So whenever I see a kid whose mask just doesn't seem to fit well, I'll grab them and give them a kid-sized mask. But if your kid wants to wear one from home, I highly recommend buying the disposable mask. They just fit better. This is one I found at Aldi, a pack of 10 for $2. And it has, I cut it open, has 3 layers, and it has the nose bridge, and it's great. If it's still not fitting well, you can tie up the sides like I did with this one and tuck it, and there are YouTube tutorials about how to do that. So I recommend doing that. And if you need some mask at home, like I said, MNPS has a lot of child-sized masks, and a lot of times I'll get a little baggie and stick 10 in them and send them home with kids who I think might need some. So reach out to your school nurse. We are here to help. We love helping, and we love sharing whatever resources we have. Let's see. Another thing that I really beg of parents is If your child has seasonal allergies or asthma or any chronic health conditions, please let your school nurse know. Because if they're coming to school and they're coughing a lot in class or their nose is running, teachers might say, oh gosh, go see Nurse Amy, go see the nurse right now. But if I know that kid didn't take their Zyrtec, or they have seasonal allergies or asthma, I'm not going to be like, oh goodness, you need to go immediately for a COVID test right now. So please communicate that stuff with your school nurse. And if your kid, if you do have to pick up your child and they're ill and they go get a COVID test, please, as soon as you get that result, let the school nurse or the teacher know. So if they are positive, we can quarantine any kids that child has been around. So, but the schools are doing a great job about keeping kids, limiting as much contact as they can, so we're not having a lot of close contacts. So I'm really proud of us for that. And I'm ready for questions.
Thank you, Nurse Powell. In order to keep us on time, I want to make sure we only have time for a couple questions. I did promise the person in charge that I would do my job to start on time and end on time. So the first question is for Dr. Pennick. What is a good sleep hygiene routine?
Great question. One, usually keeping the room as quiet and experts say dark. Well, that's developmentally something you have to deal with your child. If your child's afraid of the dark, a nice night light, usually with their character, favorite character, can be helpful. Try not to do things like exercise right before they go to bed. Also, try to cut down the electronic use right before bedtime, so that the ambient light and all the bright side effects or sound effects and stuff won't keep the child awake. So a winding down routine, whether it's reading a book, whether it's taking a shower and just getting a nice back rub from their parent, and keeping it as routine as possible. Have the child even read the book, can be helpful.
Thank you, Dr. Pennick. Nurse Amy, I'm gonna throw this question over to you. Is there any specific type of sanitizer that works best?
I'm not that I know of. I think that as far as hand sanitizer goes, you want it to have at least, I think it's 62% alcohol. But it's also the one that, like masks, the one that you're going to use. If it's one that's really sticky and one that doesn't smell good, you're not going to want to use that. So get one that has at least 62% of alcohol in it, and one that you don't mind using all the time.
Perfect, thank you. And Dr. Gibbs, I want to get you in really quickly, hopefully really fast, to answer this question, because I believe it's very important. If a child tests positive in the class, what is the normal process? What's the process?
Okay, I'm going to jump on. Hey, this is Kelly Akers. I'm going to jump on for Dr. Gibbs and take this one, and then a couple of my colleagues might follow up as well and kind of go from there. But let me make sure I have the question, and that is, what is the process if a child tests positive at school? Is that correct?
Yes.
So of course, we're moving into a new phase of having access to rapid testing at the school level. Of course, parents will have to give us permission to do that. So we will be sending home permission forms. Parents will give permission for any sort of testing that happens at school. Now, if the school is notified that a child has tested positive, the first thing we do as school leaders is we immediately consult with our school nurse and connect the school nurse to the parent to ensure that all the proper COVID protocols and procedures are followed with the contact, with the recommended amount of quarantine time, with any contact tracing, etc. That's when we're contacted if someone outside of school, comes in or calls and lets us know they've had a positive case. But within school, we're moving into a new place where we are going to have access to rapid tests. So if a child has COVID-like symptoms, and those can be administered by school nurses at the school level, but again, we will require parent permission to do that. So I hope I answered that, and my colleagues, if I missed something, please jump in. All right.
Perfect. Thank you, Mrs. Akers.
You're welcome.
All right. Well, we want to thank each of our panelists for joining us this evening and sharing your expertise. And for our families, we hope we were able to fill in some of the gaps and answer your question. To our panelists, you definitely made us smarter this evening. We appreciate the work you're doing to keep us safe. To our audience, remember, it's essential that we do our part by protecting ourselves and others by wearing a mask, socially distancing, staying at home when you're sick, and staying away from large groups, and plus washing your hands. So please be safe out there. It's been a pleasure. Dr. Hopkins, is all yours.
Thank you very much, Mr. Jackson. This has been awesome. Not only has it been awesome for our families tonight, but it's been awesome for our schools. Knowing that the 5 magnet schools here in Metro, we value our children and our families to the point to where safety is our utmost concern. And this information has been so valuable. I would like to say a very special thanks to Dr. Onuoha and to Dr. Banerjee and to Dr. Pinnock and to Nurse Powell, and to you, Mr. Jackson, for being our moderator. The fact that this information is being recorded, we hope for our families that were not able to hear this information on tonight, they will get an opportunity to hear this valuable information at another time. Of course, the 5 schools being represented: Glencliff Entrepreneurship STEAM Magnet School, Inglewood STEAM Magnet School, Rosebank STEAM Magnet, Warner Arts Magnet, and Whitsitt STEAM Magnet as well. We are very appreciative of this, and we say thank you for this opportunity to share this information with our families. And I just want to add an extra, because Dr. Pinnock, that same, I can't wait to put that in a newsletter for my families. I've got it down pat. The S is for schedule, and then you added sleep, then the active learners, and then to motivate and to monitor and to engage and to encourage. All of you gave us valuable information, and we're very appreciative of it. Thank you.